nationals directly. Okay, I think we have had like three NCs. Maybe one proper. No, I think there was one on national strategic plan last week. No, I didn't attend. So if we have continuous engagement like we have presently, as a country, as leaders in the sector, we will take collective decision and we invest appropriately. But I need to put something right here, particularly for those who are planning to help us. I mean, Nigeria, we need a lot of help in their system. But the help that will be given should be defined by our needs. It should not be developed in Switzerland or in America and brought here, or Abuja. It should not. Okay, so either you are into communication, you are into technology, whatever help, you need to come to my Jebugo town. My sister is there looking at this. You need to come to Jebugo and understand my problem first, so that we will conceive the help together, and so the help best suits my purpose. So
thank you very much.
Mr. Smule asked, is there synergy between the state government and the federal government in the context of the 10,000 PhDs at this country? I will not play politics, but let me say that we have a new government now, unitary government, so we are all in one party. But prior to that, I will tell you, Lagos City will always fighting the federal government at any level. Even right from the insurance scheme thing, started a long time ago. So because of force, we finally agreed that, okay, let's decentralize. Every state can develop its own system. When I heard of the 10,000 primary healthcare, what we heard was that the federal government was going to build, and I said to myself, this would not be my idea. Because we have so many primary healthcare facilities not functioning, why you go to build new ones? But over time, these things started changing, which is an expression of that synergy. So, so right now, we're in constant partnership, like my colleague said, we're in constant touch. The fact is that, just like defined the Constitution, when we were going to start our own insurance, we went back to the Constitution. And this is said, primary health care, just function of both state and federal. Both of whom jointly provide health services to that group of people. And that's why Lagos State decided a couple of years back to now at least assist the local government in putting more resources to the primary health care system along this line. But with 10,000 PhDs, things are changing. They're now listening to us, they're now engaging with the states, okay, which facilities do you have? Because I'll come back to the state government. We have about 187 primary care facilities. Only about 30 or 40% of them are fully functional. So why do we need to build more? And the focus is make the remaining more functional. At least you can get mileage in what we have. So that's the focus. How do you do that? Train, staff, equip, provide those systems you require. And these are the things, and luckily too, we are getting assistance from the federal. And like I said again, our partners, I think we started about 2-3 years back to create a partners forum. And then all the partners working in the health sector in Lagos State, we said, sit down. Whatever you are coming to do must be in line with their own plans. And there will not be, you don't have duplications. And luckily too, at least that has been streamlined. We have a very good structure. We have a forum where we meet and we have technical working groups that actually build up that system to the final assembly. So it's working. With the donor agencies, it's always been a battle because they will go to Abuja, then they create that wall in Abuja and come down with some trickles, and that's where the fight started. I recollect the malaria control program, and they said they were sending us 4-point-something million mosquito nets. And they came to my conference room, and about 30 people came. And I said, you don't have work? I said, how did you calculate that we need 4.2 million naira? Because they were basing our population through their own records. Population of Lagos State at about 12 10 million when we were operating on 20, 22 million. So you have that shortage. So in the past, Lagos State also been at the receiving end, no support, but things are changing. So there's synergy.
Thank you very much. Thank you very much.
Good afternoon, everybody. My name is Siba Agbeyegbe. I'm a recent returnee to Nigeria, so I come from the other side, so to speak. And my greatest claim to fame is I'm not a doctor, but I work in health management, and that is the pattern that works in a lot of the world. But there are so many barriers in this country to non-doctors coming in to help the profession. So the first thing I really want to say is, please make better use of resources outside of the medical profession. There's a lot of capacity outside of medical practitioners. They're managers, they understand process mapping, process flow, they understand almost everything, aside maybe from the technical, clinical knowledge, which can be picked up over a few years. It's not immediate, but it's definitely a solution to our capacity issues. And the second point I want to make is, we are a nation of 180 million people, and that's the figure that's put out there, and Lagos alone has 20 million. A lot of our medical practitioners have left the country, they operate outside, they're highly qualified. And what I feel is that our greatest resource is our human resource. We can train again, we can do a Cuba. Cuba trains doctors en masse, diversity. You have a resource, you've got an economy in Nigeria in people. So I believe that if you get the right partnership for proper education of our clinicians, we will solve our own pipeline clinical issues. We will also solve global clinical pipeline issues. Because globally there's a shortage of clinical staff, medical practitioners, doctors and nurses that are fully qualified, able to work anywhere in the world. And I really feel that that's something we need to put our mind to from a strategic perspective.
We've all identified that skills gap, capacity building, training are essential areas in this. So this is an opportunity. We'll be talking about opportunities that are available to improve healthcare performance. This definitely is a route to performance. Dr. Joseph is a healthcare provider who has had the opportunity to work in several PPP models with government. So we'd like her own perspective about what it takes to provide healthcare as a private practitioner for the public sector, and some of the areas that we could also look at generally.
Thank you very much. To start with, you're giving me what to talk about. No, let me just, you've told me what to talk about, but before I even deal with that, I have something I have to say. I want to tell the commissioners that we will definitely not make any progress in Lagos State, in both private sector and public sector, without capacity building of our human resource. It is a real crisis, and it's something that we have to address. Otherwise, all what we're saying, new innovations, change, cannot happen if the substrate is wrong. So there's a need for you to reach out to either your academia, your tertiary centers, Nigerians in the diaspora, or companies that are interested in continuing professional development. Get them together and streamline which areas they would address, both clinical, ICT, and hospital management. That's number one. Number two, there's the need for innovation, innovation, innovation. We're a third world country, whether we like it or not. They start dividing into medium, low. I think in terms of our performance, a lot of things we're doing it like low resource countries. And that's why our health system is ranked right at the bottom. So we have to bring innovation. And I think one of the nice things we could do that would reduce cost is commissioning of services at all levels. We call PHC. PHC, I think it's something that was devised to help us by WHO and other international external donors. We should be talking about primary care services, because we find that a lot of times the programs in the PHC are stovepiped to link with what the external donors have as their own projects. We should look at our population, like Dr. Ekwaye said, and determine the problem. You have mainly geriatric in this area, then you should be giving primary care services for your geriatrics. Standard, there will be children, there will be pregnant women, everything. But don't just stovepipe it to what, this is a beggar's, to me, a beggar's phenomenon. And we're not like that. As Cameron called us fantastically corrupt, he didn't know what he was saying. What he was saying is that we're very different people. The Nigerians are very different people. Whether it's corruption, in goodness, in there, whatever we do, if given the right incentive, we will do par excellence. So if we sit down and develop innovative ways, we look at our problems, we now ask people come and sort out the problem with geriatric. We need people to sort out the problem with neonatology. And then we start along the chain from prevention to curative to rehabilitation till we research, till we sort the whole problem out. I will just give a little caption. I know you said it in 5 minutes because I have to tell you about our experience. We set up 4 women's and children's hospitals in densely populated peri-urban areas of Lagos. And the reason why is because we feel that peri-urban health is one that is not really addressed in our public health domain. It's more urban, rural. There is this area, slums around the cities, people with a lot of needs, very little time, and it affects the statistics, but nobody is really getting adequate data to compare these people. And we started giving acute care services, first with children, then we integrated with mothers, and have currently devised something very simple. We call it the Fever in Children campaign. You know why? Because the health statistics, they will tell you that 60% of children who die from preventable conditions, they call VAP, all sorts of terminologies, malaria, pneumonia. But what you find, from what we found, 90% of the sick children, we've seen over 60,000 sick children, 90% of them have fever. So it only makes sense that we need to develop our services, whether it's health promotion, health prevention, curative services, and rehabilitative services for children with fever. And I think so we started a campaign now, and we've now started streamlining and making very specific and having service standardization in care for children with fever. And our statistics in terms of the numbers, our clientele are increasing, our outcomes are improving, because we're training all the workers and they all have specific roles in this chain. So I would ask that Lagos State Government, Ogun State Government also have a similar model. Go and do an analysis. If it's fever, when these children come, when we are planning, we start from how do we prevent people from getting fever? How do we prevent? How do we promote good household practices? How do we make the best of our poor infrastructural setting now to prevent children from having fever? And when they have fever, how do we increase their access to quality care? And how do we rehabilitate them after? So I think if we start commissioning services, thinking of specific problems we have, our PHC should all have a hypertension service. Our PHC should all have geriatrics. We should all have maternity. Then you would see, even in terms of getting data for Nigeria and improving, because if you don't have data, you don't know what to work on. You don't know your weakest link. So thank you very much for allowing me to say something.
I believe we've achieved what we want to achieve here today. And one of the greatest things is to speak about the opportunities that exist in the healthcare sector. As far as optimal performance is concerned, we've been able to identify several areas where things are happening, innovations are out, several forms of improvement on access to care. We've also been able to identify that technology is a very strong aspect in the path to delivering sustainable healthcare strategies. And we've seen several opportunities that are actually in operation in that regard. We've heard from government, and we can see that our government is working. we are here to also provide opportunities for support. PharmAccess is here to provide that access and to help build sustainable partnerships that will return, severe investments on all these strategies that are being put in place.
I agree with you, we need capacity building. But my experience is that we need to do what we call targeted capacity building. We need to define it. We need to do a well-structured, need-based, targeted capacity building. That is not academically linked. It doesn't, we don't need to link it. We have had enough input when it comes to training. We are the best. Anywhere we go in the world, the analysis is simple. Once you produce a doctor in Nigeria, it goes anywhere in the world, is one of the best. That is the analysis. Go to everywhere, they are everywhere in the world. Being the best. What we need to do is to do targeted, what role will this person be playing, and train for that role. I have led a World Bank project in Nigeria, a $225 million project, implemented in 35 states. 51% of the envelope was used for capacity building, and no capacity was built. I didn't want to talk,
So please don't.
but you need to understand that we all know we need data, we need information. We have institutions of higher learning where we assume that all those research work they do, they make the findings available to policymakers. But that's not so in this country. What we find is that the professionals that said they do research, they hoard the information because they want to take those information out to push it out into other things. We are killing our system. So it's not as if government, who is government anyway? All of us are government. Let's understand that. So the first question, I got you right. Non-medical workers, they're very good. Management is there. Logistics management is there. I'll always refer to that issue of Ebola because putting everything together, drugs, personnel, all those things, requires non-medical training. And without that, I don't think we'd have achieved the success we achieved. But we need that system to within the health sector. How do you move our commodities, family planning, drugs, etc.? These are the things we can get from those non-medical people. And lastly, you mentioned something targeted, whatever it is. In this state, we conducted research work on mental health, which everybody fails to look at. It's a major issue. I remember cracking the joke that I said 82% of people in Lagos are mad. Somebody picked up on the net. I said, including you. I said, yes, including me. But see, the reality is there. We have that huge number of mentally challenged people. And how many psychiatrists do we have? How many psychologists do we have? Like you just say, want to perform miracle. They don't have the resources. But again, that's what the essence of partnering with every one of us here. I think we are making